Good morning, good afternoon, depending on where you are. This is your Dr. Eunice Menja. I am back here just for a quick study, um, just to talk about conversion disorder. Um, Remember my source? I am getting this information from DSM-5-TR. So, conversion disorder is also known as functional neurological symptom disorder. It is a condition that is categorized or characterized by neurological symptoms that must be inconsistent with any known medical conditions and are not explained by other mental or health disorders. So the symptoms, they are going to mimic those of neurological or medical conditions, but they have no underlying organic cause. Understanding the symptoms, diagnostic criteria, and treatment options for conversion disorder is essential for maybe a test, or if you are in the healthcare, mental health field, feel free to use these notes. Obviously, I always say that this is not a diagnostic procedure. This is for me to study for MFT and also to teach anyone that wants to learn with me. So let's look at the motor symptoms. So the motor symptoms are the most common presentation of conversion disorder and may include things like weakness or paralysis. The patient might have abnormal movements, including or such as tremors or jerking motions or gait abnormalities. So those ones would be motor under the motor symptoms. So if you notice those ones, and then of course, if the client has the sensory symptoms. So the sensory symptoms might include disturbances in sensation. The client might complain of numbness, tingling, or loss of sensation in some specific areas of the body. So someone reporting a complete loss of sensation in their hand or foot, despite no evidence of nerve damage or injury that would have explained such a symptom. I did say that for the motor symptoms, if someone is experiencing those sudden weaknesses or paralysis in their limbs, that makes it very impossible for them to walk or move their arms, and there is no injury that has occurred that someone can say, oh, I got injured when I was running and that's why I'm experiencing this. So definitely that is going to be one categorized under conversion. So the seizures and or conversions, some individuals with conversion disorder may experience seizures or conversions that resemble epilepsy. There are people that have epileptic seizures, but the epileptic seizures symptoms in conversion disorder have no neurological basis. So just know that they have no neurological basis, and that's why they are under conversion disorder. So someone that may be experiencing something like uncontrolled movements or their arms and legs, loss of consciousness, that resembles, someone that has epilepsy or epileptic seizure, but no abnormal electrical activity in the brain. So obviously they do the brain analysis and find out that this is not is not related to the epileptic seizure. Then that would be categorized under conversion disorder. So for the diagnostic criteria, the diagnosis of conversion disorder is made based on specific criteria that is outlined in DSM-5. For this case, I'm using DSM-5, the textbook revision. So the text revision, TR, that's what it stands for. So the requirement for a patient to meet the criteria for conversion disorder these symptoms must be inconsistent. I'm going to repeat that, must be inconsistent with any non-medical conditions that they can't be explained by another medical or mental disorder, must cause significant distress or impair someone socially, occupationally, or other important areas of their daily functioning or functionality. So that's how you're going to definitely specify for the conversion disorder. So the impacts on daily life is also key. So must significantly impact daily functioning and quality of life. So might lead to disability, sometimes stigma, because when you're in the presence of other people, like your body is conversing, and you have the abnormal movement. So you might have difficulty relating with other people, whether it's at work, in the community, or even school. That impacts your daily life. So individuals that have conversion disorder experience limitations in their ability to perform daily activities, um, such as self-care tasks, occupational responsibilities like going to work or fulfilling their work duties, challenging their social interactions with other people because of these symptoms, especially the motor, sensory, and the seizures or conversions. So for treatment, the treatment for conversion disorder is going to definitely involve multidisciplinary approach. Definitely psychotherapy, physical therapy, and also, psychoeducation. So people need to be taught or be educated about this disorder, and they so that they can understand why they are going through these symptoms. So psychotherapy mainly is going to involve things like cognitive behavioral therapy or CBT. Other forms of psychotherapy may help the individual identify and address underlying psychological factors that could be contributing to these symptoms. Physical therapy, obviously, such as activity pacing, graded exposure, might help the patient to gradually increase their activity levels and maybe regain their daily functional or daily life functionality. So for the education, as I said again, is providing education to the client about conversion disorder and how just the significance of these symptoms and how they can impact their lives. It's the symptoms, the prognosis can help the individual who is dealing with this to really understand their condition and also reduce the distress as well as the anxiety that comes with experiencing these symptoms, because it can be scary for the clients. So it's important to understand these symptoms. Again, as I said, I haven't come across any medications that are typically, the primary treatment for this conversion disorder. This is because conversion disorder is not caused by a physical or neurological problem that can be treated with medication. So instead of focusing on the, treatment on addressing underlying psychological, instead of focusing on medication and, worrying about what kind of medication should I take to maybe reduce the symptoms, maybe focus on treating or addressing maybe any psychological factors that could be impacting or, helping the individuals by helping the individual maintain these symptoms or manage these symptoms through psychotherapy, as I said, physical therapy, education. So maybe in some cases, medications may be prescribed to manage accompanying symptoms, especially anxiety that might arise from dealing with this disease or illness, as well as depression, because there are so many other things that could happen if somebody were to be diagnosed with this disorder. So if any medication is going to be in conjunction with the psychotherapy. Comprehensive treatment. I said multidisciplinary because it's more than just the therapist or psychotherapist working with the client. So for that, I am done with the conversion disorder. I hope this is clear for you. It is easy to learn and remember. So just in case it comes in an exam, again, do not use my notes to diagnose people. Maybe just kind of give you a hint so that you can know where to go with the client in terms of evaluation and using the DSM-5. You must be well trained to use it. I am trying to get my licensure, so I am an MFT candidate, and remembering I have come across this all these disorders in my classes, teaching students abnormal psychology and clinical psychology. So this is really for me to come here and revise, as well as just give you some quick study. So if you like this video, please like, comment. If you have any questions, share with anyone that could be wanting to study as quickly as I am doing. So thank you very much for watching, and may you have a good day.